My name is Bhargav Kansara. I'm a second-year medical student at USF Morsani, and for the past year, I've conducted research with Dr. Amir Dam at Moffitt Cancer Center. Today, we present the case of a solitary fibrous tumor in the pancreas. Solitary fibrous tumors, or SFTs for short, are rare fibroblastic neoplasms that originate in the mesenchyme. And while the majority of them have been reported in the pleura, they can actually occur anywhere in the body. They don't present with any specific signs or symptoms on physical exam or on imaging, which makes them a difficult and often complicated diagnosis to treat. What is unique about SFTs is their immunohistochemistry, or IHC. SFTs are known characteristically to express high transcription factor STAT6. That makes STAT6 a specific and sensitive marker for SFTs, along with other markers such as CD34, BCL2, and CD99. What makes our case very interesting is that SFTs are very uncommon, with only one case per million per year. What makes our case even more interesting than that is that SFTs in the pancreas are almost unheard of, with approximately 40 recorded cases in literature since 1999 when the first SFT was diagnosed. They generally present in the pancreatic head or the body, but today we present the exceptionally rare case of an SFT in the tail of the pancreas. Our patient is a 65-year-old female who presented with an initial diagnosis of SFT involving her left pleura 22 years prior to her current visit. For 22 years, this cancer has recurred in both lungs and as well as her right thigh. And for this malignancy, she's undergone many surgeries and radiofrequency ablations over the years. Today, she presented with no specific symptoms of the GI tract and no abdominal complaints, but presented for routine screening. Upon abdominal CT, the scan showed a hypervascular mass in the tail of the pancreas, and you can see this in figure 1A. The yellow arrow is pointing to what looks like a mass near the tail of the pancreas. This was followed up by the GI team, who conducted a fine needle biopsy with ultrasound, and in figure 2, you can see the results of this ultrasound biopsy. In figure 2A, you see the pancreatic tail mass, and in figure 2B, you can see the biopsy being conducted with a needle that is currently injected in the image into the mass. IHC testing, immunohistochemistry testing, was performed on the sample obtained, and you can see the results in table 1. STAT6 expression was positive, while SOX10 was negative. STAT6, as we mentioned, is a positive marker, a specific and sensitive marker for SFTs, while SOX10 is a marker for other malignancies, such as melanomas and Schwann cell tumors. Overall, the results in Table 1 confirmed for the physicians and for the patient that this was a pancreatic SFT. The patient was treated with a spleen-preserving distal pancreatotomy that was complicated during surgery and post-op by fluid collection at the surgical site, which was resolved promptly with IR intervention. Biopsy conducted during the surgery revealed focal chronic pancreatitis. Overall, this case is very interesting and important to examine because of both the rarity of the disease and the difficult diagnosis. Pancreatic SFTs, as aforementioned, have no specific associated symptoms, so it's relatively easy to misdiagnose as other malignancies, such as neuroendocrine tumors, liposarcomas, and other pancreatic cancers. Our case shows two things. First, the importance of a thorough diagnostic approach involving a physical examination, multimodal imaging, and immunohistochemistry testing, all of which are important to the final diagnosis of our patient and SFTs in general. Second, much more research needs to be conducted regarding optimal SFT diagnostic methods and treatment options. As more non-invasive therapies, such as radiofrequency ablations, are used for SFTs in other parts of the body, such as our patient's lungs, we should start to consider the possibility of applying those procedures to the pancreas to improve patient post-operative quality of life. Thank you for listening.